Hi, I'm Dr. Keith Murray from Monmouth Pain and Rehab. I wanted to take this time to talk to you a little bit about motor vehicle accidents, something that a lot of times people get into at some phase or point in time in your life, whether it's just learning to drive or whether it's later on in life, but all of us have at some point in time either seen what we call a fender bender or been in a fender bender ourselves. So I just wanted to talk about a couple points in relationship to that. Now, one of the things I want to talk to you about is what do you do when you initially get into a motor vehicle accident? Probably the first thing that you should do is make sure the scene is safe. Make sure you pull off to the side of the road, or if you're unable to, that you make sure it's safe to get out of your car. The second thing you should do is alert the proper authorities. That's important because, once again, we want to get back and make sure you have safety. You don't want to get out your vehicle and cars are passing and be unsafe, especially if you have more than one passenger in the car or young children in the car. The second thing that I would probably recommend doing is have emergency teams come out and evaluate you in certain cases. You want to make sure, once again, that you're safe. So have an emergency team evaluate you, and if need be, go to the hospital to have the proper x-rays or any type of diagnostic testing done. After that, one of the things that I would recommend, because most of the time you're very sore, even a little bit disoriented, and at points in times you're suffering from a type of shock, not a long-term shock, but shock of the initial accident itself. I would recommend you go into your nearest healthcare facility to kind of be evaluated. A lot of times in a motor vehicle accident, we have a series of injuries that we like to term sprain strains, and these injuries can happen in the neck or in the low back, or injuries to the knee because you bumped the dashboard or something like that, or to your head or to your elbows or wrists. So it's very important to have those type of injuries followed up on. If you have any more questions, feel free to check us out.